In Australia, 150,000 new cases of cancer per annum will be diagnosed by the year 2020. In other words, 1 in every 2 Australians will have a cancer diagnosis throughout their lifetime. 2/3 of those patients will receive radiotherapy.
One of the characteristics of medicine and medical science and radiology and radiation oncology in particular over the last 100 years is change. Our challenge as clinicians and radiation oncologists is to stay ahead of that change.
The research being undertaken by TROG is really vital, not just at a local level, but also internationally. And there's a huge number of examples of trials that TROG has taken part in that have really changed practice all around the world for a whole range of cancers.
Extremely important to bring together professions, to get the best out of these professions by working together, to apply that knowledge to groups of patients and extract the information gained therein to improve patients' lot in the future.
The value of TROG is that there needs to be a group that is going to coordinate research at a high standard, and that is the group that is responsible for doing that in radiation.
So we perform trials that cross the spectrum from brain tumours to breast cancer, lung cancer, bowel cancer, prostate cancer, gynecological cancers and skin cancer.
We can ensure that we're really accurately targeting the cancer and avoiding the treatment of other tissues and therefore reducing the side effects. So it's been absolutely paramount in improving the quality and outcomes from radiation therapy. And then in line with that, we can do trials that actually support the outcomes being better than before.
So the evolutions in technology have allowed us to treat really complicated diseases that in the past probably weren't treatable. So the technology is allowing ultimately much better outcomes in terms of both quality of life and survival.
Radiotherapy will not become a silver bullet, but we will get much better at treating cancers across the board and improving survival and reducing toxicities.
The only way we're going to be able to filter down to where the real benefits are going to be for our patients is by clinical trials groups like TROG exploring where the real benefits are going to be made.
TROG Research is an amazing program, and it can make people be diagnosed quicker, it can help people with the treatment quicker, and it can get you back to a normal life quicker as well.
There's all this great work that's being done, but a lot of it has been volunteer-based in the past, and I think we need to shore up some of that funding so that we can guarantee that we'll still be here in 5 years, and 10 years and 20 years.
In the perfect world, I'd like to see Tasman Radiation Oncology Group more consistently funded. I believe that a lot of the trials and the advances we've been able to make, we've made largely on the goodwill of people involved.
We need to engage better with corporate Australia so they understand the importance of what we're doing in that regard, so that important work that we're doing can carry on.
The beauty again of this, doing that in a highly respected organisation like the Tasman Radiation Oncology Group, is that this is hopefully not just helping patients in Australia and New Zealand, but also patients all over the world.
The ongoing success of the Tasman Radiation Oncology Group is crucial because it's going to improve the cure rates of our patients, but also the quality of their lives, not just for now, but for generations to come.